And so, as I continue to talk about the fact that Donald Trump is threatening to cut all HIV funding for Zambia um, if they don't give, I would say, privileged access to their precious resources or natural resources. I just want to go into some of the programs that have been cut that have been shown to actually um, help health officials in Zambia to detect the disease and to actually establish responses to them and to prepare themselves for future infections. So, this is from Dr. Lloyd Mulenga, who leads Zambia's national HIV program. And they had to decide what programs do we cut so we can run on austerity, right? So, when a person tested for positive for HIV, a team tracked that person's sexual contacts, because, right, counseled and tested each of them and put them on HIV treatment if they were infected. This labor intensive system, known as index testing, found 70% of the infections identified each year. It has shut down, right? So, again, and I'm also going to mention that one of the actual after effects of this war in Iran is the fact that condoms are more expensive. And that's not to say that, like, people can't participate in just not doing it, but you want to make sure people are safer, right? But it's more expensive to get condoms. It's just a weird, everything's just like running into itself. Pregnant women with HIV had the amount of virus in their system tested 3 times over their pregnancy, so that a clinician could respond quickly to any hint that their medication was failing and their fetus exposed. That testing has been cut to once. Babies born to HIV positive mothers were tested for the virus through a accurate but expensive genetic test within hours of birth. An antiretroviral treatment was started immediately for those tested positive. Now babies are not tested until 6 weeks old, when a cheaper standard blood test can be used. Everyone who came to a medical center of any kind of care was tested for HIV. Now testing is restricted for people who ask for a test or have another sexually transmitted infection or tuberculosis. So, and just going off of that, right, the fact that because of the cost, right, they're cutting back on the amount of testing and the amount of services that they can provide for people that are at risk, which is going to lead to people falling through the cracks, which is going to lead to a non-negligible amount of people increasingly showcasing HIV and then later AIDS, which is then going to basically roll back the clock on Zambia's ability to defend against the disease. Because if we go back, right, I've talked about this before, Zambia's life expectancy like 30 years ago was 37 years. Yeah, 1996, it was 37 years, right? That's how long you would live. Just to give you a hint, I'm 32 years old, right? I think I have a long time to go. Who knows, right? Now, just from the article, it's 67 years, right? So we're rolling back the clock. We're not making progress. We're not even stagnating. We're regressing in our ability to make life better for people. And the fact is, remember that the Trump administration, they love talking about how babies, right? They even complained about how there are not as many teen mothers, which is a good thing for your society that you don't have a bunch of teen mothers. But whatever. Because of the way that they have upended this funding, they can't test babies and treat them for HIV exposure. How can you call yourself a Christian who is pro-life and you are cutting programs that help, that helps to make sure that babies don't suffer from HIV infection? But as we know, these people are not true Christians. All they believe and all they use Christianity for is domination. Right? That's the brand of Christianity that they've been taught, that God conquers enemies, and because he conquers them, you rule, and you rule because you're white. Like, that's literally their religion. It's also why, never mind. So, as we go down, they also did genetic testing to make sure that they could actually know how new an infection was, right? So they could basically see, hey, where is this happening? Where is this person from? And is this area a hotspot that needs an actual intervention from our team? That's gone, right? Antiretroviral drugs were distributed in communities, market shops, at churches, the places that people go in, they have to go, they interact, right? making it easy and discreet for people to get their medication. Those sites were closed. This is actually particularly important because there is a shame. There's a shame aspect of receiving the help that you need, right? Especially for a sexually transmitted disease. And for you to lose the ability to be discreet in the places that you deliver this help, you see that you're going to have people who are going to suffer because they do not want the shame of being associated with treatment. Now, it's a backwards way to think about it. If you're sick, you may want to get healthy no matter what, but it's something that some people go through, right? Some people need a way to basically be able to keep their pride amongst them. We're losing that, right? So more infections, less people treating themselves, more people getting sicker and sicker. And there's a couple more things where I'm going to stop there for now. But the fact is that we're no longer testing people in the ways that we should be, right? The most important form of testing in which they tested all the sexual partners and they counseled them, right? That led to around 70% of, I think, the discoveries of infections. That's been shut down, which means that the only time you're going to really see people, if this kind of system continues without any help or assistance, is when people are too sick, when they're too sick, right? And in a lot of cases, when it may be too late to help them. You're losing the ability to actually make sure that children are safe, right? You're losing the ability to actually treat children because of the cost, right? You're losing the ability to give people the medicine they need whenever they need it. And the Trump administration says that they are the most moral, right? Everything's better because the white people are back in charge. But all we've seen is that they just want an excuse to initiate like a reign of terror on the world. Like, this is some actual, I don't know what this is. I think they're just trying to get rid of all the black people. I don't know what it is, how to describe all this, because this is crazy, right? Because they'll sit back and proclaim that they are doing good for the world, when a good thing for the world would be to make sure that people are not getting increasingly infected by an infectious disease that your country helped initiate the greatest reversal in fortunes for people in this country who may have contracted the disease. So I'm going to stop there for now, though.